Welcome back. We continue with our introduction to gross anatomy. This is part 2. So here we're going to discuss the body cavity that we have, and the cavities are the body are parts that house the internal organ. We have two: ventral, as we defined in our terminologies. Ventral is the front part. Cavities, then there's dorsal are the back part. Cavities. Ventral cavities, we have abdominal cavity that houses the abdominal organs. We have the thoracic cavity that houses the lungs, the heart. And abdominal pelvic, we have pelvic cavity that houses the pelvic, and abdominal cavity that houses the abdominal organs. Pelvic organs can be reproductive and some of the renal organs. Ventral cavity, that is the cranial cavity that houses the brain, and the vertebral cavity that houses the spinal cord. Let's discuss more about the ventral body cavity. As I've said, it houses the lung and the heart, protected by the rib cage, associated musculature, and sternum anteriorly. It consists of the right and the left pleural cavity and mediastinum, the medial part. The portion of the tissue and organs. Abdominal pelvic, we said, extends from the diaphragm inferior to the floor of the pelvis, divided into superior abdominal and inferior pelvic cavity by an imaginary line passing at the upper pelvis. So abdominal cavity contains stomach, intestines, liver, spleen, and gallbladder. The pelvic cavity contains the urinary bladder, rectum, portion of the reproductive organs. Ventral is the back, that is the from cephalic cavities, cranial cavity it houses the brain. Ventral canal, that is cavity, contains the spinal cord. Another terms are anatomical terminologies of movement, that is extension and flexion. Extension is increasing the ankle of a joint. Flexion is reducing the ankle of a joint. Abduction is you're coming towards the midline. Abduction away from the midline, like you see here. External rotation is rotating the part of the body away from the midline. Internal towards rotating the part of the body towards the midline. Elevation is moving up superiorly, moving the part of the body superiorly. You're elevating mostly. You can elevate the chin, you can elevate the shoulders. You can also, the opposite is depression, moving downwards, like moving superiorly, part of the body superiorly. It can be the chin, you can also depress it, and you can also depress the shoulder. Inversion and eversion is turning inwards. The sole of the foot, it look like be upwards, and inversion is turning the sole of the foot downwards. I don't know, you can invert by turning the sole of the foot outward, or invert by turning the sole of the foot inward. Circumduction, you can circumduct your arm, that is moving in a circular motion in all planes. We can continue. Dorsal and plantar flexion. Dorsal is standing on your heel and reducing the angle between. Dorsal flexion is reducing the angle between the dorsal part of the foot. Plantar is increasing the ankle and also reducing the angle in the posterior part of the ankle region. And that you will extend the ankle in the anterior part of the ankle region on the dorsal aspect. Finger movements, we have radial adduction. Radial adduction, of course, is moving the thumb towards the other digits. Abduction is away from the other digits. Adduction of the fingers with the third digit as our midline. You open. Opening is adduction, is abduction. Closing is adduction, like it's bringing together is adduction. Taking away from each other is abduction. Flexion and extension, of course, you can flex the digits, and of course you can extend, just reducing the ankle between the eight joints. Palmar adduction, it's the same story. Opposition is opposing the thumb to the eighth of the digits on the distal parts, not on the middle. Distal parts, like here. And retroposition is away, taking it away from the distal parts of the digits, eight of the digits.